And the third part is investigation. That when we have done history, when we have done examination, we come to investigation. And a lot of us feel the diagnosis is pretty easy. There are all the investigation available. In my time, when I did MD, which was in 1980, I finished my MD, there was no echo, there was no ultrasound, there was no CT scan. So you can understand my plight. I had to diagnose rheumatic mitral stenosis, mitral regurg, only based on my ears and stethoscope. And I remember there used to be a 1 hour discussion as to one is saying this is mitral stenosis, mitral regurg, the other is saying no, there is an aortic regurg also somewhere there. And we did not have the final word because the investigations were not there. Now we have all the investigation in the world. And so many people have stopped using their stethoscope. He says, to hell with this stethoscope. Let's get an echo done. Why are you wasting your time? But I will tell you that stethoscope is still relevant. I give you an example, very recent. A lady, 32-year-old, came to me with complaints of weakness. He says, I'm feeling weak. She had delivered a baby about 6 weeks back. And she says, I have no appetite and I have extreme fatigue. And she had all damn investigation done. Her LFT, ultrasound, this, that. When I put stethoscope over her heart, I could hear a gallop rhythm. Gallop rhythm. And I say, oh my God, you got perpural cardiomyopathy. We got the echocardiogram done, and yes, her ejection fraction was 30%, her whole heart was dilated. So even today, especially in India, stethoscope is relevant, is not irrelevant. As far as investigation is concerned, even when you are trying to diagnose diabetes, where it's very simple, get a blood glucose done and you will be able to diagnose. It's not that simple. To give you an example, there are 3 ways you can diagnose diabetes. 1, by getting an HbA1c done. 2, by getting a blood glucose fasting done. 3, by getting a 2 hours after 75 gram glucose done. And all of these are venous plasma sample, right? But now, asymptomatic executive comes to you with reports, and there are about 30 pages of report. Now the reports are so long. And you see a fasting blood glucose of 127. So by definition, he has become diabetic. Anything beyond 126 is diabetes. And his A1C is 5.8. So by definition, he is pre-diabetic. So where do you go? So it's not that easy. Still you will have to use your judgment. And you should know what are the guidelines. So what I'm saying is that even in diseases where you just have to do a simple blood test and you will be able to know, you will not be able to know. You have to use your mind. So let's talk about something about investigations. Whenever we get investigations done, we should have these 3 things in mind. They are very, very important. Number 1, why the hell we are getting investigation done? If it turns out to be positive, is it going to change our way of thinking, our way of treatment, or not? If not, why the hell you are getting it done? To give you an example, why the hell you will get a rheumatoid factor done in an individual who does not have arthritis or synovitis or anything? He just have joint pains. Joint pains is arthralgia, it's not arthritis. And I have seen many doctors, good, educated MD doctors, diagnosing rheumatoid arthritis just on the basis of R factor passage. To hell with it. There is not even arthritis. So why did you get it done? What did you think? Very important. So if the test is not going to change the way you treat or think about the patient, you are wasting the patient's money. Then, second is also very important. What is the pre-test probability of having that illness? Now, I'll give you an example. These are real-time examples. A young girl of 22 years of age is complaining of chest pain. This is one patient. In another, 55-year-old smoker having chest pain. Both get an ECG. In both cases, the ECG is normal. The way we react will be different in these two individuals. Because in the girl, the pre-test probability of having a myocardial infarction was remote. God has given women estrogen protection. And unless the women waste that protection by consuming alcohol, smoking, tobacco, or something, she cannot have a heart attack. She can give a heart attack, but she cannot have a heart attack. On the other hand, men, even at the age of 20, can have a heart attack. And this patient is a 50-year-old smoker, very high chances, pre-test probability very high. So what will you do in these two patients? You will discharge this girl. You say, go home, don't worry. You will not discharge this 55-year-old gentleman with the same results, normal ECGs. In that case, you will do an echocardiogram, you will do a trop-I or trop-T and try to confirm the diagnosis. So very, very important before you do test. And the third, again, which will decide the reliability of the test, is what is the sensitivity and specificity of the test. There is no test which is 100% sensitive and 100% specific. There is no test. That's the good thing about medicine, that you cannot give the medicine over right now to robots. You will have to think. If we talk about the sensitivity and specificity, now these are the two examples I'm giving you. ANA is 97% sensitive and 82% specific. What does it mean? 97% sensitive का मतलब क्या हुआ? कि 3% पेशेंट में false positive नहीं, false negative आएगा, right? That the patient will be having the disease, but this test will not pick it up. It's false negative. And in about 18% of patients, it will be false positive. That the test is positive, but the patient does not have systemic lupus erythematosus. Understood? So, इसका क्या मतलब हुआ कि आपको not only test याद रहने चाहिए, बट उनकी सेंसिटिविटी और स्पेसिफिसिटी का लगभग अंदाज़ा होना चाहिए. इतनी सारी टेस्ट की इतनी सेंसिटिविटी स्पेसिफिसिटी आप याद नहीं रख पाएंगे, बट एटलीस्ट आपको आइडिया होना चाहिए कि ये पॉजिटिव आ गया, इसका मतलब ये नहीं है कि बीमारी हो गई. अगर फीकल एलास्टेस देखिए, फीकल एलास्टेस क्या होता है? एज द नेम इंडिकेट्स, फीकल इज फीसिस, elastase is an enzyme, and this is secreted by pancreas. It does not get altered during this transit, so you can pick it up. The easiest way of pancreatic exocrine deficiency diagnosis is fecal elastase. कि pancreas के दो काम हैं, एक exocrine, एक endocrine. आप exocrine काम assess करना चाहते हैं तो पहले fecal fat था और बहुत सारे टेस्ट थे. This is a simple test. कि स्टूल का एक सैंपल लो, उसमें टेस्ट कर लो. कॉस्ट अराउंड 4,500 रुपीज़ और समथिंग. सो अगर ये देखिएगा तो इसकी 63% सेंसिटिव है. दैट मीन्स अबाउट 27% पेशेंट यू विल मिस. इट विल बी फॉल्स नेगेटिव एंड बट इट इज़ वेरी स्पेसिफिक. वो ज़्यादा सेंसिटिव है और स्पेसिफिक कम है. ये ज़्यादा स्पेसिफिक है ना. तो that's how you understand the test. So that's the reason why some tests are misleading. If you ask me, हमारी कुछ टेस्टों ने ज़िंदगी ख़राब कर रखी. इतने ज़्यादा मिसडायग्नोसिस होती है बिकॉज ऑफ दोज टेस्ट कि I get irritated. Sometimes I feel those tests should be banned because they are not leading to a right diagnosis, they are actually leading to a wrong diagnosis. And people are using it for wrong purposes. Especially Vidal and Typhidot should be banned. Patient को बुखार ही नहीं है और वो मेरे पास आता है कि पिछले 1 साल से मुझे टाइफाइड है. Wow, great. You are a superhuman being. You are surviving after 1 year of typhoid fever. Amazing. Good, let's clap. क्या है? बुखार नहीं है, लेकिन सारे विडाल टेस्ट पॉजिटिव आ रहे हैं. अच्छा, जो विडाल टेस्ट को पढ़ता है वो ये भूल गया है कि राइजिंग टाइटर इज व्हाट इज इंपॉर्टेंट. इट इज नॉट जस्ट वन टाइटर. दैट वेरी डाइल्यूटेड, वेरी स्मॉल टाइटर में अगर प्रेजेंट है तो उसकी कोई वैल्यू नहीं. लेकिन अगर पॉजिटिव है भी तो देखो कितना खराब है. 37% सेंसिटिव, 62% स्पेसिफिक. बेकार का टेस्ट है, करना ही नहीं चाहिए. और क्या करना चाहिए? ब्लड कल्चर. गुड. सो ब्लड कल्चर डन इन द फर्स्ट 1 week विल बी द गिव यू द मैक्सिमम. आफ्टर दैट थोड़ा सा डिफिकल्ट हो जाएगा क्योंकि उसकी सेंसिटिविटी कम होती जाएगी. Then you have to do stool culture, maybe bone marrow culture or whatever, but in the first one. So it's a stupid test. And same is true of rheumatoid factor. So many people are started on immunosuppressive therapy lifelong for rheumatoid arthritis when there is no rheumatoid arthritis, just because there has been pains and R factor is positive. So we got to be very, very careful of using these tests. If you look at the criteria of American Rheumatological Society of diagnosis of rheumatoid arthritis, rheumatoid factor is just one. There has to be more than that, and it says at least 4 criteria has to be positive. So even if rheumatoid factor is positive, it doesn't make you a patient of rheumatoid arthritis. There has to be other factors which is positive. And you will say morning stiffness, and that also more than 1 hour. Whenever we get up in the morning, we are stiff. But that usually lasts for 10-15 minutes. If you are stiff for more than 1 hour, then we call it morning stiffness, not otherwise. So everything is written. You just have to be careful. हम लोग चलता है एटीट्यूड में पैदा हुआ. बाईं तरफ नहीं चलना, दाईं तरफ चलो. ये रास्ता बंद है, इधर से खोलो, है ना. ये किसने कहा कि 8 ही बजे डॉक्टर सोंदे की क्लास में आना, हम 8:10 पे आएंगे, लेकिन मैं बंद कर दूंगा क्लास. सो प्लीज़ इन माई क्लास यू हैव टू बी हेयर बाई 8. मेरे क्लास में चलता हुआ नहीं चलेगा. मेरे हाथ में आपका कुछ नहीं है. आई डोंट गिव यू मार्क्स, आई डोंट गिव यू अटेंडेंस, बट स्टिल इफ यू वांट टू लर्न यू हैव टू कम एट द राइट टाइम. सो these are the, so how can you diagnose on just on the basis of one stupid simple test? इसलिए अब एल्गोरिदम बन गई है. एल्गोरिदम बन गई है. एल्गोरिदम क्यों बनी है? बिकॉज कंप्यूटर आ गया गेम में. अब नाउ द कंप्यूटर इज इन द गेम, सो एवरीथिंग विल हैव एन एल्गोरिदम बिकॉज दैट्स हाउ द कंप्यूटर विल थिंक. बट दैट्स हाउ आवर थिंकिंग इज बिकमिंग मोर क्लियर. अगर ये है तो ये करना, सिंपल थिंकिंग. अगर हीमोग्लोबिन कम है तो सेकंड स्टेप क्या होना चाहिए? MCV. ये माइक्रोसिटिक है, मैक्रोसिटिक है, नॉमोसिटिक है, रेटिकुलोसाइट का. एंड देन यू गो इनटू द एल्गोरिथम. इज माइक्रोसिटिक, दिस इज द एल्गोरिथम फ्लो चार्ट. इफ इट इज नॉमोसिटिक, इज दिस इज द फ्लो चार्ट. एंड सो द एल्गोरिथम विच हैव कम अप इन द क्लिनिकल प्रैक्टिस, which was not there at my time, has clarified so many things. It's become इतना क्लियर कर दिया है कि आपकी थिंकिंग भी क्लियर हो जानी चाहिए. अब जैसे इसमें लिखा कि जॉइंट स्वेलिंग 12 हफ्ते से ज़्यादा है या नहीं. अगर 12 हफ्ते से कम है इसका मतलब वो वायरल कुछ और हो सकती है. अगर 12 हफ्ते से ज़्यादा है देन इट कुड बी रूमेटॉइड आर्थराइटिस. तब वो कह रहे हैं कि साइनोवियल स्वेलिंग 3 जॉइंट्स में है या नहीं. नहीं है तो ये हो सकता है तो फिर ये हो सकता है. एंड देन यू गेट द टेस्ट डन एंड देन यू डायग्नोज. सो दिस इज हाउ your mind should work. Your mind should not jump to a conclusion by just looking at a rheumatoid factor positive report that yes, I've got a rheumatoid arthritis patient. What is it? What is it? Raise your hand and tell me. Raise your hand. Yes.
Symbol of open AI.
Good. So if you do not know this, you should not be here. Because that means you are only concentrating on medicine. Please, for God's sake, there is so many other things going on which is going to affect your field. This is a symbol of chatbot, open artificial intelligence. The artificial intelligence is already here. It is going to change your life. This is a new revolution going on. Today, if you ask a chat GPT, this is chat GPT symbol, if you chatbot, so you go to the chat GPT and say, please tell me how I should treat a microcytic anemia, it will give you whole written with. You don't have to consult the books. Of course, the information in this is till 21 probably, no 22, right. So it's slightly 1 year old, but still pretty good. It can give you essays, it can give you everything. This is a chat GPT. And of course, what is this? I want to know the name. The most talked about humanoid robot, which has got the citizenship of United Emirates, United Arab citizenship दे दी गई है इस lady को. She is not a living person. She is Sophia. She was made in 2016, 7-year-old. She has given so many interviews. She has appeared on so many TV places, right? She can talk to you like one-on-one. What does these two figures mean? These two figures mean that you are in for a big jolt. I mean, of course, is damned because when I was born, 1980, there was no Wi-Fi. So you are talking to a person who did not see Wi-Fi. First time I bought a computer was 1 lakh rupees. And when I wanted to go on Wi-Fi, for a whole night I was sitting and I was not able to go on Wi-Fi. The tune was coming and it was not connecting. That frustrating. So now it is so good. It is changing. Your medicine is changing. There are closed loop system made for controlling type 2 diabetes, type 1 diabetes. Closed loop system. लगे हुए हैं. What does that mean? एक चेक कर रहा है कितनी शुगर है और दूसरा उतने ही इंसुलिन डाल रहा. You don't know to do anything. So there are closed loop system available now in insulin pumps, which cost around 3 to 4 lakh rupees. You get those system and your sugar is like this. Oh wow, straight, not like this.